This is my presentation on upper extremity stability and mobility. Today I will be demonstrating exercises used for the stability of the shoulder girdle, which will be performing a scapular push-up, the stability of the shoulder joint performing a standing reverse fly, and the movement of the shoulder girdle and shoulder joint performing a lateral raise. First, I will demonstrate the scapula push-up, which is a closed kinetic chain exercise, and it occurs in the sagittal plane and the medial lateral axis. In this exercise, the shoulder does not move. It is an isometric contraction. The shoulder remains in flexion throughout the exercise, and it is brought by the anterior and middle deltoid, the pectoralis major and coracobrachialis. The stabilizer muscles of the shoulder are the rotator cuff muscles, which are the infraspinatus, the teres minor, supraspinatus, and the subscapularis. Looking at the scapula, the concentric contraction is during the protraction movement, brought by the serratus anterior and pectoralis minor, which act as movers. The antagonists are the rhomboids and the lower middle trapezius, and the stabilizer muscles during protraction would be the levator scapula, upper trapezius, and some of the middle and lower trapezius fibers. Next, we'll demonstrate the movement of the shoulder joint doing the standing reverse fly. This is another open kinetic chain exercise that occurs in the transverse plane and the vertical axis. The concentric contraction of the shoulder is during the horizontal abduction movement brought by the middle and posterior deltoids, the latissimus dorsi, infraspinatus, and teres minor. The antagonist is the pectoralis major, and the stabilizers of the shoulder are the rotator cuff muscles, which are the infraspinatus, teres minor, supraspinatus, and subscapularis. The concentric contraction of the scapula is during the retraction movement brought by the rhomboid and the middle and lower trapezius. The antagonists are the serratus anterior and the pectoralis minor. The stabilizer of the scapula are the levator scapulae, upper trapezius, and some of the middle and lower trapezius fibers. Lastly, we will demonstrate mobility of the shoulder girdle and the shoulder joint combined. We will be demonstrating the lateral raise, which is an open kinetic chain exercise that occurs in the frontal plane and the sagittal axis. This exercise consists of two phases, the abduction phase and the adduction phase. The abduction and concentric phase is the upward rotation of the scapula and abduction of the humerus. Then there's the shoulder adduction phase, which is the eccentric phase. It is when the humerus moves back towards the midline. The muscles targeted in this concentric phase include the supraspinatus, the deltoids, and the upper pectoralis major, which all occur in the shoulder joint. In the shoulder girdle, it targets the serratus anterior, middle and lower trapezius, levator scapula, and the rhomboids. That concludes my presentation on the stability and mobility of the upper extremities.